I want to just very quickly, one last round, and then we'll open it up to the audience, ask if there was one or two things that jumped out to each of you from either the report or what you heard this morning that was either the most compelling thing that you need to take back and act on, or the most surprising thing. And we just heard one from Laura, so Jennifer.
So to me, the most surprising finding was the difference in mortality decrease for females and males, and the fact that it is so much less for males. And I was surprised by that, and that's something I have to think about. Mm-hmm.
I'll put it in terms of, shall I say, a reaffirmation of something we knew before, but which this really helped bring to the fore even more, which is the need for concurrent action on multiple fronts. It's the judicial sector, if you like, in terms of an adolescent responsive judicial system and the framework. Okay? A recognition that what a young adolescent needs is an education, not marriage, for example. And also the fact that if you imagine a country's cabinet sitting together, it requires action by the Education Ministry, it requires action by Ministry of Youth and Sport, action by Ministry of Health, Ministry of Transport, and all of these have to be synchronized. But more importantly, they need to be sufficiently ingrained in public discourse that they outlive the tenure of any particular prime minister or any particular president, talk less of any minister of health, whom, as you probably know, happen to have very short shelf lives.
What's compelling to me is some of the things that has come out today, and that is to have meaningful, respectful engagement of youth, and the role that youth could play to hold us accountable. We need good indicators that shows whether we are making progress or not, that we can really be held accountable to. And I think there is still work to do to have those indicators. What really surprised me was when looking at problems and ill health facing adolescents is really the role that mental health plays, depression in young women. And it's really amazing how much stigma is surrounding this very prominent problem. And I think it is important because this problem, it stands out in this report, but also in the Global Burden of Disease separate estimates. And that is that we're dealing with a real public health crisis here of depression and harm among young women, and how blunt the instruments are, how we are not using the opportunities in early adolescence to pick up the problem and dealing with it effectively, how much it costs in this country because we are failing to actually grab that opportunity. And what I think also is important, that depression among adolescents is in all income groups and in all geographies. And that, I hope, will be something that this commission and other work will contribute to actually tackle seriously and getting us out of the stigma box that this is sort of put aside.
Here. We look forward to talking to the foundation about that further. Laura, do you have anything else? You're good?
No, I think that already said.
Okay.
I think one thing that I want to say for the future is the link of this with the Sustainable Development Goals, and this is the generation to invest on for achieving the Sustainable Development Goals. So there is a lot of work to do at the country level, but also at the very global level of really committed politicians that will invest in different aspects of this. One good, I think a very good outcome of the commitments that the 44 countries have made to the global strategy for women, children, and adolescent health is that they have all included adolescent health as one of their areas of commitment. So from the report to the action, as you have said, George, I think there is a lot to do, but I think that the link is there, as in the introduction of the Secretary General is included in the Lancet Commission report, and so we have a lot to do. Yeah.
I think for me, the fact that when we think about adolescent health and well-being, it goes beyond just the health of the child. We're talking about education. We're talking about protective systems. We're talking about legal structures. We're talking about the totality and being of the adolescent, which, you know, which should challenge us to begin to think out of the box in how we design interventions and programs to meet the needs of this population.
Thank you. Great.